Hello, friends. Welcome to this special session of She and Rights Live from Women Deliver Conference 2026, which is being held in Narrm, Melbourne, in Australia. The theme of this session is Legally Binding Treaty for Development Justice for Older Persons. She and Rights live sessions at the Women Deliver Conference 2026 are being hosted at D03 Exhibition Space in Melbourne Conference and Exhibition Centre. All sessions are hybrid, live streamed, and host online and on-site speakers and participants, including media. She and Rights is co-hosted by Global Center for Health Diplomacy and Inclusion, SEDI, and CNS, with partners like Women Deliver Conference 2026, International Planned Parenthood Federation, Asian Pacific Resource and Research Center for Women, Asia Pacific Media Alliance for Health, Gender, and Development Justice, and Health TV Online Nepal. Longevity is one of humanity's greatest achievements, friends. Yet, the promise of longer life is too often accompanied by persistent gaps in the protection of human rights. Instead of celebrating older age, most people fear it, and ageism fuels this fear. Ageism lurks. This session focuses on currently being drafted legally binding UN treaty for human rights of older persons, with a focus on women, indigenous peoples, persons with disabilities, and other marginalized and vulnerable communities with a life cycle approach. I, being an older person myself, was among those with lived historic first ever drafting of the treaty in Geneva in February 2026. This year is indeed a historic first when governments came together to draft a legally binding, possible treaty to protect the human rights of older persons. The first ever intergovernmental working group meeting to protect the rights of older persons was held in February 2026. IGWG, as it is called, was created by the Human Rights Council in April 2025 and given the mandate to draft a legally binding UN Convention on the rights of older persons. It has taken older persons, with support from the not so old ones also, over 2 decades of advocacy and efforts to reach this point, where governments are convening to draft a legally binding possible treaty to age with rights. The process follows the recognition that existing international human rights treaties do not specifically address the human rights of older peoples, leaving them vulnerable to violations, particularly regarding access to care, social protection, and in humanitarian crisis. Well, better late than never. The convention is expected to protect the rights of older persons, valuable economic and social contributions older persons make, and provide a comprehensive and coherent framework for a world free from ageism and age discrimination. While opening the IGWG meet, Nada Al-Nashif, the UN Deputy High Commissioner for Human Rights, said that meaningful participation is essential. Older persons themselves, in all their diversity, including older women, older persons with disabilities, those belonging to indigenous peoples, minorities, and rural communities, must be actively engaged in this process. Civil society organizations, national human rights institutions, and independent experts bring indispensable experience, data, and insight. An inclusive and transparent process will strengthen both the legitimacy and quality of the outcome. Ageism is one big elephant in the room. It includes harmful norms, stereotypes, narratives, and tropes against older persons. It affects women more than men, less educated people more than the better educated ones. To be a gender diverse person or a woman or one with disability and to be elderly is double trouble in many countries, including mine of India. More so if you stand up against ageism and do not fit in the norm. Subtle nuances of ageism abound in every nook and corner and lurk where you least expect them. Homes, society at large, workplace, industry, healthcare facilities, media. The list is endless. Longevity is one of humanity's greatest achievements. Yet, the promise of longer life is too often accompanied by persistent gaps in the protection of human rights. Instead of celebrating older age, most people fear it, and ageism fuels this fear. This session focuses on currently being drafted legally binding UN treaty uh, for the protection of human rights of older persons, with a focus on women, indigenous peoples, persons with disabilities, and other marginalized and vulnerable communities with a life cycle approach. While opening the IGWG meet, Nada Al-Anashif, UN Deputy High Commissioner for Human Rights, said older persons themselves in all their diversity must be actively engaged in the process. Civil society organizations, national human rights institutions, and independent experts bring indispensable experience, data, and insight. Let us invite today our opening speaker, Dr. Mabel Bianco, a noted feminist leader and founder, Foundation for Studies and Research on Women, actor for Latin America and the Caribbean International Federation of Aging, IFA. Over to you, Mabel.
Thank you. And I'm very happy to be here to share with you my experience and the problems we have, especially in Argentina, but also in Latin America, about the elderly women. Because as you know, in most of Latin America, but specifically in the Southern Cone, the issue of elderly grows very soon. And now we are having in Argentina 13% of our population is 65 and older. And among them, women are the most important, specifically after 75 years old. So this is why we are so interested and so preoccupied how we work. But traditionally, my organization, Foundation for Studies and Research on Women, we were more oriented to young women and to women adults and related to some problems that are more for adults. But now we need to understand that the change, and it's not only in Argentina, but it's also in all Latin America, is how we pass from the care of the young and the children to care of the elder, and how we balance both, because these are some of the problems we have. Traditionally, our countries were much more oriented to child care. Now we are moving to the other. Well, what happened in that? First of all, I must say that also among an older women, I'm 85, so I'm really old.
You don't look old, okay? And you're not old in your mind.
So I say, I'm not working so hard as I used to before, but I'm here. And what I want to say is that for us, in Latin America, and specifically in Argentina, the problem is about how are the care. Because one of the points is in most of our countries, they are people receiving retirement. But the retirement sometimes, as happened in Argentina, for women, we couldn't reach the number of years to retire as done the men. So the problem is we have had some laws that allow us to retire without all the years of abroad, but in a way that what we call a moratorium. So we could retire having less amount till the moment we could reach. While we receive the retirement, we afford the funds. Now this ends in Argentina. And what we have seen is that last year, the decrease in the retirement is about 41%. And among them, most are women, because we are having the problem. Many of them, the women, we have been working all our life, but we didn't take care if the approach has been done. So when we reach the age of 65, sometimes we are not allowed. Now, as they cut these moratoriums, we are not able to retire as before. This is one of the first problems. The other problem is how with the moratorium, the women, we are, most of us, 80% of those in retirement, we are in the lower income group. And now the government, since they changed in December 23, when the new government entered, maybe you know, Milei is a right-wing man, they cut the increases. So all the retirements are in the same level. So what happened? 80% of the women retired are receiving the low. So one of the problems we are claiming is that for us, it's very difficult to decide, are we going to buy medicine or buy meals? Are we going to pay the houses, or are we going to go to our children's houses and live with them? This is something that's affecting, and we have a defender of elderly persons, and he is telling the government and everybody that this needs to be take care and change, because it's affecting the life of the people, of elderly and especially elderly citizens. So what it is about? It's about that we need to ensure access also to health. One of the problems is for the retired people, sometimes when they have social protection, when they retire, they are continued being supported by the group of the social protection. In Argentina, they created a special group entity that is called PAMI. This is giving support to all the retired people. But the problem is now they are not having the sufficient money. So they cut the coverage of medicine, and they also are cutting the cover of the healthcare system. So this is another problem, because especially the women, they need to go to the public services, and the public services are very bad, very poor, they have nothing. So this is the moment in which we are. So that's why I think for us, and that's why for me it's important to be in the International Federation of Aging, in order to bring these problems and to fight for this treaty, because we need that the governments worldwide are going to be supporting the elderly people, and of course the elderly women. And because we are most, when we are becoming older, as the age grows, we are most of us alive, and we lost the men more than the women. So this is why I think it's so important now. And if we consider that the issue of aging is something that is not only the bad conscious that all of us, we are going to be elderly. And if they are not, who are of them? Because they are going to die before. So this is a bad news. But we want the people to remain and become elderly. But if they don't think when they are young about that, when they reach the age, they find all these problems. So this is why we need to start to work intergenerational. Sorry, sometimes I have difficulty with the English language.
That is perfect, Mabel. You are so good with the language.
And that's why it's so important, because they need to understand that this is a problem all of us we are going to have. So we need to consider since when we are young, how it's going to be solved and to prepare for that. I think the people need to be prepared, and especially the women, for the elderly age. Why? Well, because in the early elderly age, we need to consider that all the things that we suffer when we are younger are going to be becoming worse.
Yes.
So we need to take care. Maybe it's a small problem, it's not very important, but it's going to be most important when we are elder. Second, we need to maintain the exercise in order not to be lost and to become completely unable or very unsure to move when we are. And of course, we need to take care about our bones because the most important problem is about the loss of calcium and so on. So we need to be also doing a good support for the future. These are things that are very easy to say, but very difficult to do. That's why I think we need to involve more in this intergenerational groups saying, and I think it's a very good idea to come here to Women Deliver, because Women Deliver is most seems to be for the young people, but it's not only for the young people, it's also for all of us. So that's why I think it's a very important point. And what I can say is for the people listening from Latin America and the Caribbean, that they want to be in contact with myself as a representative and director of International Federation and Nation, I'm going to be ready to bring the voices and to have some possibilities to build and say what happened in Latin America. And I'm very happy to share with the people from the Pacific because I think we have similar problems, but we are not very often communicating. No, thank you so much.
Thank you very much, Mabel. And I would like you to add to your list the social harmful norms which are associated with the older people. In many countries, like in India, you are past, say, 65 years, you can't go. Why should an old person go on a pleasure trip? You go to religious places. That is the time for you to do that. And the sexual health and health needs of older people are neglected, like in many cases, like you do screening for cancers, they say after 70 there is no need to do that because it seems as if we have lived our lives, so we don't need to be screened for breast cancer. I think
HIV.
NHIV, yes, same, yes.
They suppose we are not going to have
It's-
HIV because we
yes,
are older.
yes.
So no pressure, no
yes.
sexual life, nothing.
Right. So that sexual health part is also, and sexual rights are totally neglected. So I'm sure with young women like you, Mabel, and all of us, me also, we are able to bring some change. Thank you very much. Now we will listen to Dr. Pam Rajput, Emeritus Professor, Panjab University, India, and former Chairperson of Government of India's High-Level Committee on the Status of Women. Over to you, Pam.
Thank you. Thank you so much. I hope you can hear me. My voice is a little cracky today
Yes,
because
very
of bad
clear.
throat. Yeah. Dear sisters, attending the Women Deliver Conference 2026, my dear friend Shobha, and of course my role model Mabel on the forum today. I take this opportunity to congratulate Shobha and her organization, She and Rights, for organizing this event and titling it rightly, Development Justice for Older Persons, and inviting me to share my thoughts. Now, before I say something on that, I would say that I ditto every word that has been uttered by Mabel on the issue. And let me share a day before I was traveling in India to Ranchi to address the inaugural session of a conference on policy for rural women. And all through I took the flights, the question I was asked, are you traveling alone? Are you traveling alone? So this gray hair you see puts you in a category where the question marks begin. And also, I must confess that for the last couple of years, there has been a focus on intergenerational dialogue. And especially at the UN, what you feel is that you talk intergenerational, but in the intergenerational factor, as Mabel said, it is about the younger people. The older people tend to be ignored for that matter, and that is why you see, I said yes to Shobha when she shared the theme of the today's meeting, that the word that have been used is development justice. So I think that is where we need to focus, and it is the duty of governments, international bodies, civil societies to recognize their role and build on the strength of, I would like to emphasize the word continuum, and not to consider this group as dependent or redundant. Of course, you are talking about the convention. I'll come to that later, but I would say that you know if you look at the data now, the demographic transformation that is taking place, and for the first time in human history, the number of older persons globally is rising faster than any other age group. By 2050, there will be over 2 billion people above the age of 60. Yet the question before us, as we talk about development justice, is not simply longevity, it's one of justice. What does it mean to grow old in a world that is unequal and exploitative? What does development mean if it excludes those who have built it? And development justice demand that we move beyond charity. Invariably, when you look at the programs of the governments, they are in terms of charity, not recognizing that these are their rights. So we have to talk in terms of rights, we have to talk in terms of dignity, and we have to talk in terms of inclusion. So reframing agency, from burden to contribution, we have to recognize that older people are workers, they are knowledge holders, they are community leaders, they are caretakers, and in the global south, you will find them to be invisible backbone of informal economy. Furthermore, aging is not experienced equally. The inequalities, as already being talked about, are shaped by gender, shaped by caste, shaped by class, geography, and access to resources. Development justice demands that we confront the intersecting inequality. Further, also, of course, it is the Human Rights Council which is looking into, but I would like to emphasize that the framework should be a rights-based framework. The global community has been engaging right from the Madrid time to General Assembly resolution, Secretary General report, and of course UN decade of healthy aging, etc., etc. And there is also General Recommendation 27 of CEDAW, which also talks about the normative framework of rights for older people. And now, of course, is the process going on, regarding the convention, which Shobha mentioned at length, and I do hope, in time to come. So what I want to say is that each time that is time to move from aspiration to accountability. Accountability is the key to that, and justice is not achieved through policy declaration. I want to underline this alone. It is realized through lived change, for that matter. And as we go ahead with this, I would like to emphasize, of course, both Shobha and Mabel have talked about that how aging is gendered. Women live longer, often with the fewer resources, higher vulnerability to poverty and violence. Development justice must be feminist, for that matter, and that is what I would like to underline. And we must recognize the cumulative disadvantages they face across the life cycle and the development model, which is exploitative. And also, I must emphasize that intergenerational approach is key to development justice, and it should not be seen as one generation versus the other generation, or for that matter, one generation at the cost of the other. It is about reimagining solidarity across generations. Older generations have contributed, and the young through their and young, of course, through their innovation. So a just society we really need to build. It should be There should be bridges, not dividers. Nothing about older people should be decided without their being on the table. So it is very important that older people have a role to play in governance. Older people should have a role to play in policy making. Older people should have a role in community building. So participation is not systematic, it has to be transformative. So must it be emphasized that development that excludes older people is not development, and it is discrimination indeed. And the measure of a society is not how it treats its most powerful, but how it carries or honors those who have walked the longest journey before that. It is in this context that we need to have a convention. And of course, now the efforts are on. But one feels I want to digress for a moment, that we keep having conventions one after the other. We have CEDA, I just referred to that. And if you look at Afghanistan has also ratified CEDA. But what does it mean, right? So what we have the conventions which would be legally binding, but how do we see that, they are really affected and translated into life every day? So with a clear intent that we don't inherit the future, we built across generations. The development justice begins with dignity and doesn't end with it. So I do hope that this panel that we are having will go a long way in strengthening the convention that is going to be adopted, right? And the question is not asked, are you traveling alone? You know why I call Mabel as my role model? Anytime I have to go for a conference, I think, should I go or should I? No, if Mabel can go and contribute, why should I not contribute? Right? So that's why I called her role model. But you get a feeling in the meetings, right, that your gray hair are not respected over there with that dignity. We have contributed, we have ideas, and that is the reason. Let me end by saying, maybe I have taken more time, that any meeting that I convene, right, when they ask me, I say I'm the youngest amongst you. The question is of your own spirit of working, your contribution that you want to make. So that is what so if I can question something, why not? Right? And that is what the development justice is, that it is with dignity and not with the gray hair that you count on the face of the person. Thank you very much, Shobha, for giving me this opportunity to share my thoughts with you and the women who are attending Women Deliver Conference 2026. Thank you.
Thank you very much, Pam. And I agree with you totally. We do not want mercy. We want our rights through the lens of development justice. And gray hair, that way they are becoming fashionable amongst the younger people also. They are also having two colors of hair. So as far as fashion goes, they are taking that. But otherwise, no, the color of the hair should not matter, although it does, as you said. But let us hope for better days to follow for us. Thank you very much. And moving forward, now let me invite our long-time inspiration, Dr. Imran Pambuti, Director of Vulnerable Groups, Health Services, Ministry of Health, Indonesia. Older persons, ending violence against women, persons with disabilities are some of the focus areas of Dr. Pambuti. Welcome, Dr. Pambudi. And before you begin, we must acknowledge your foundational contribution to advancing TB control and other health responses in Indonesia. Over to you, sir.
Yeah, thank you, Shobha. So good morning, good afternoon, and also good evening for everyone who joining this forum. Yeah. So I would like to extend my sincere appreciation to the CNS that invite me to this event. Around the world today, millions of women and girls wake up not knowing whether they will be safe, hurt, or protected. This is the really we must confront. And globally, 1 in 3 women experience physical or sexual violence in her lifetime. But behind this number are those who remain unseen. older women, women with disability, and also girls in vulnerable situations, too often excluded from data and therefore excluded from protection because of if we do not see them, we cannot protect them. Ladies and gentlemen, so let us bring this closer to home. In Indonesia, reported cases of gender-based violence increased over 14% in 1 year, reaching more than 330,000 cases in 2024. The majority of these cases involve sexual violence, accounting for more than 1/3 of reported incidents. Perhaps most concerning, estimated 90% of rape cases are never reported. This means that what we see in the data is not only the surface of much deeper reality. And these numbers remind us that violence affects women and girls across all stages of life. In Indonesia, like many countries, is undergoing a significant demographic transition, like also in Argentina. Yeah. Today, older person in Indonesia make up around 12% of our populations. So it's around 35 million in Indonesia. And this is increasing, yeah, and projected in 2045, it will be around 20%. And this means that protecting the rights, health, and dignity of older persons is not a future concern. It is a present responsibility. And we also know that in Indonesia, our life expectancy at birth is around 73 years old. But our healthy life expectancy is only 61. So it means we have around 11 to 12 years old that people live in disability. And most of them are older person. That's why disability will be also increased in elderly. And we're talking about, you mentioned about intergenerational dialogue. It's also important since Indonesia, around 40 to 50% elderly live with 3 generations in their home. Yeah. Means that they live with the children and also grandchildren. So I think this is not only we talking about what the elderly will receive, but how the elderly will also give to the next generation. I think it is also important. And within the growing population, older women face even greater vulnerability, often experience economic insecurity, like you mentioned, limited access to healthcare, and also increased risk of neglected and also violence. So we must also recognize the situation of persons with disabilities in Indonesia. Approximately around 15.2 million people are living with disability, many of whom face significant barriers in accessing healthcare and also social services. What is particularly concerning is that a substantial proportion of disability is linked with the injuries, accident, and also violence. And this is remind us that violence does not only harm in that moment, but it can have lifelong consequences. In other words, violence today can become disability tomorrow and the future. So persons with disabilities also face significant health inequalities. They are twice as likely to experience health problems compared to without disabilities. And yet, nearly 1 in 4 still does not have access in health insurance. So this is reflect critical gap also. And at the same time, older person face a growing burden of disease. So in Indonesia, since February 2025, we did free health checkup for every citizens. So until now, we have around 7 million out of 35 million elderly are already screened. So more than 60% of them live with hypertension. And also striking around more than 90% have insufficient physical activities level. So those figures highlight a critical challenge, ensuring not only longer lives, but also healthier and more active ones. Because inactivity will lead to disability also, right?
Yeah.
So, ladies and gentlemen, this is why protecting rights must go hand in hand with ending violence against women and girls across the life course. Violence persists where systems fail to protect, where voices are not heard, and where inequalities are left unaddressed. This is where the health sector must play a critical role, not only for the treatment, but also prevention, early detection, and also survivor-centered response. So in Indonesia, we are not starting from the zero. We have taken important steps to strengthen protection and improve health services for vulnerable populations. For example, we developed elderly-friendly primary healthcare services, to ensure that older persons receive care that is accessible, respectful, and also responsive to their needs. We also strengthening the capacity of primary healthcare to improve long-term care services, recognizing the aging requires continuous and integrated support. And for survivors of violence, we are expanding the role of primary healthcare service facilities to deliver comprehensive health service for women and children affected by violence, including early identification and appropriate referral. And in addition, we are advancing disability inclusive health services by improving accessibility in primary healthcare and ensuring that the services are responsive to the needs of persons with disabilities. So we hope that through this effort, we aim to ensure that every individual, regardless of age, gender, or ability, can access quality healthcare and live with dignity. So, ladies and gentlemen, this is not a challenge for one country alone. This is shared globally responsibility. As our population ages, as we continue to strive for gender equality, we also must ensure that our effort reach those in the intersection of vulnerability, which are older women, girls, and persons with disabilities. And it could be for example, for the elderly, we should start from the pre-elderly phase, not start from the over 60. I think this is too late. Let us strengthen our commitments. Let us invest in the inclusive systems. And let us ensure that no policy, no program, and no data leave for the most vulnerable behind. So we have, but who we have detected along the way. I think that's all from Indonesia. Thank you.
Thank you very much, Dr. Pambudi, and thank you for your feminist approaches towards it. Because the feminist approach is very important to deal with these. Here from my dear friend Rita Vidyadana, former editor of the Jakarta Post Indonesia and advisor Development Justice for Older Persons. Over to you, Rita.
Oh, sorry.
Still mute.
We are not in the.
Yeah. Okay. Sorry. First of all, I would like to thank my dear colleague Soba, Sukla, CNS team, and CN Rights team also for inviting me to share my thought, to share my humble experience as a senior citizen and senior journalist. I mean, over 60 journalists in Indonesia in these prestigious events. I would like also to greet our respected panelists, Dr. Mabel Bianco, Professor Pam Rajput, Dr. Imran Pambudi, and Miss Margaret Young, and all distinguished participants on site and online. Okay, since I'm not expert in geriatry or demography, I just want to share my experience and see this issue from the media perspective. Um, I think it can be challenging, as Dr. Imran Pambudi said, to live as elder person in Indonesia, especially for women over 60. The challenge are even harder. Why? Because the society and the media as well often associate older men with wise and experienced figures. Is that right, Dr. Imran? While at the same time, elderly women are portrayed as vulnerable,
Yes.
sick, in, and, and frail rather than independent and empowered individual like Soba. Well, it is unfortunate that the media depiction of elderly women in Indonesia and elsewhere in the world really affect societal perception that contribute to various discrimination of elderly women in families, in workplace, and in daily life. Now, as a media and the society and all people, it's high time for us to recognize their social and economic contribution that they make to their families, communities, and to be included in large variety of national development program as well as international development program. So Dr. Imran Pambudi has already explained very comprehensively about the conditions of Indonesian aging population and also the problem faced by women, girls in Indonesia, and also as well as elderly person. I think the majority of elderly woman condition in Indonesia is always associated with poverty, lack of social safety nets, and seen as unpaid care burden as a grandmother, as a mother, and also lack of education, lack of social safety nets, and so forth. So I think why? Because I think the media play important role in framing these pictures. And now as a media, we have to uh, change this perspective. Media can help encourage elderly woman-friendly policy by shaping public perception, shifting the narrative from passive aging to active and empowered participation. Media in Indonesia and elsewhere, especially mainstream media, do not have space to write elderly women friendly content because lack of space, because they need more ads. But I think has to be changed. In Indonesia and elsewhere in the world, we have seen the emergence of independent and alternative media, such as in Indonesia we have Konde.co, Magdalene, focusing on gender and right-based contents. This is important because we, the media, are responsible to framing that elderly women are weak and sick. Now we have to change. Now, as an elderly journalist, I have to encourage young journalists, young people in the media to change the landscape of their coverage of elderly women, elder persons, people with vulnerability, people with disability, to be more friendly. I think it is promising for us in Indonesia to see a lot of media now, alternative media, rarely mainstream media, to start writing in-depth reporting on gender issue, gender right-based issue, on including elderly women's needs. So I think this must be a start point for us, the media, to do the right things, to push holding decision maker accountable regarding policy that negatively impact elderly women, such as how to build elderly friendly public infrastructures, sidewalk, airports, healthcare facilities, and other supporting system. And also, we have to try to train and promoting gender sensitive reporting by training writers and journalists to produce gender transformative content that can help change the discourse of aging at local, national, and international level. We also have to provide a voice and a platform for placing elderly women issues on the national development and international development agenda, especially in the health, economic, and social sectors. Now it's, I think Soba will agree, and my friend in the media will also agree that we have to change the news landscape on how to place the elderly persons, elderly women issue on the forefront in their various platforms. So people will change the perceptions. And also the media are have the obligation to holding decision makers accountable, like Dr. Imran Pambudi said, that Indonesia already has implemented several policy that are elderly friendly, but the media must be critical on whether the implementations are already on track, such as Posyandu Lansia. I would like to ask Dr. Imran, a community-based health service for elderly individuals. The challenge when elderly person visit such healthcare service, they have to queue, they have to wait for hours because lack of health trained personnel in that facility. So I think that must be changed. And also Indonesia has also national health insurance schemes, but it is very difficult for elderly persons to get access to that health insurance scheme. So I would like to ask Dr. Imran, and also financial assistance for older individuals. I think not many elderly people are covered by this financial assistance. So I think this must be properly managed by the government, the community, and other organizations. And also providing appropriate nursing home for older individuals, because in Indonesia, it's rather, it's a cultural stigma that older people who live in such a nursing home are abandoned by the family and they are poor. So this has to be this should be changed. So I think all of us, the media, are now responsible to do the right things, to put elderly persons' issue in their coverage positively, encouragingly. So, because there are many elderly people, elderly women who are still active and still contribute to development program in their own countries. Thank you, Soba.
Thank you very much, Rita. And thank you for bringing in the media perspective, because media can change the skewed perceptions he has about older people. Thank you, my young friend. And last but not the least, we have Margaret Young, founder of Age Noble and past chair of Global Alliance for the Rights of Older People, GAROP. Over to you, Margaret.
Greetings. My name is Margaret Young. I am founder of Age Noble, a Canadian social enterprise advancing human rights and human development in older age. My sincere thanks to Citizen News Service and Development Justice for Older Persons for convening this timely and important conversation. It is an honor to be part of the session alongside Rita Budadana, Shobha Shukla, Dr. Imran Pambudi, and Dr. Pam Rajput. Today, I begin with a simple truth. Development justice is strongest when older persons are recognized, included, and empowered. We speak often of gender justice, youth opportunity, and equity. Every young person is moving through the life course. Every girl may one day become an older woman. That means the rights of older women are not separate from the rights of younger women. They are part of the same life course story. Advancing the rights of older women strengthens gender justice across the life course. Development justice also needs to be life course justice. Many inequalities accumulate across life and become sharper in older age. Lower earnings, unpaid care, widowhood, violence, isolation, and barriers to health and participation. Older persons are rights holders whose rights must be promoted and protected, whether in times of vulnerability, exclusion, or need, or in pursuit of leadership, participation, and their own human development. They are leaders, workers, carers, mentors, organizers, and change makers. When older persons are recognized, justice reaches further and benefits all generations. Across the world, older persons are already helping to advance the goals of development justice. Let me share 3 examples. In Kenya, older persons are advancing leadership, enterprise, and inclusion. They still have dreams, skills, and contributions to make. In Nepal, older persons trained in self-care, prevention, movement, nutrition, and peer support are becoming community champions, helping others. In India, older persons are helping communities to adapt to drought, water scarcity, and climate pressures through lived knowledge and practical leadership. These examples remind us that older persons are not on the margins of development justice. They are part of how development justice happens. And these contributions are strongest when older persons are recognized as rights holders, and when their rights are promoted and protected. This is why a future UN Convention on the Rights of Older Persons matters. Through Age Noble's consultation with local and global communities, a 7-point proposed framework on the human rights general principles that matter to older persons emerged. 4 of these principles have particular meaning for strengthening older persons' participation and contribution in development justice. The first principle: dignity and equal worth. Older persons are human beings, no less than others, with equal dignity and worth. Needing support for care must never reduce rights, respect, or recognition. Development justice must also protect voice, choice, and control over one's own life. This brings us to the second principle: personhood and self-determination. Older persons remain full persons and rights holders throughout older age. Self-determination includes supported, relational, and evolving ways of shaping one's life. Rights are not real unless they are enjoyed equally. And this brings us to the third principle: equality and non-discrimination. Older persons are entitled to equal enjoyment of rights without ageism or intersexing discrimination. Equality means removing barriers so that rights are real in practice. And as our world changes, rights promotion and protection must remain strong. And this brings us to the fourth principle: resilience, adaptation, and future relevance. Rights promotion and protection must remain strong as our societies, technologies, environments, and the realities of aging change. As longer lives create new realities, rights must be real and effective for older persons today and tomorrow's older persons. Together, these 4 human rights principles help ensure development justice remains rooted in the rights, inclusion, and dignity of older persons. They are strengthened by 3 further principles. Together, the proposed 7 principles form a strong foundation for the future Convention on the Rights of Older Persons. The work of drafting this future International Human Rights Convention has now begun at the United Nations in Geneva. An organizational session took place in past February. In July, our attention turns to the Convention's foundation, its conceptual framework, the guiding principles we just discussed, and the structure of the instrument. Age Noble was proud to contribute a submission grounded in the lived experience of older persons and the insights of local and global stakeholders. A future convention on the rights of older persons is a rare opportunity to shape how all of us age in the future. We have seen how instruments such as CEDAW helped advance the rights of women and girls worldwide. But governments and diplomats cannot do this alone. It needs the voices of older persons, civil society, and people across generations. We bring lived experience, real-world insight, and the legitimacy needed to shape a strong convention. First, be part of the convention process. Join the July session, where the foundation will be shaped. Raise your voice and bring others with you. For more information, search Intergovernmental Working Group on Older Persons' Human Rights. Second, wherever and whatever you work, bring older persons fully into the work, not at the edges, not as an afterthought, but as contributors, partners, leaders, and rights holders. Third, older and younger people. Let's join hands to advance human rights of older persons. Older age is not someone else's future. It is a future many of us hope to reach. For older women and all older persons, claim your rights. Your voice, leadership, and experience matter now. For younger women and all younger people, shape the future you want to grow older into. For all of us, let us build a world where everyone can age with rights, dignity, and self-determination. Because whatever we build now will shape how we all age in a more just world. Thank you.
Thank you very much, Margaret. And we will remember what you said here. And with this, we come to the close of today's session. I thank our honorable and respected speakers, Mabel, Dr. Pambudi, Rita Vidyadana, Pam Rajput, and Margaret. I would just like to close by the remarks of the UN Deputy High Commissioner for Human Rights, Nada Al-Nashif. Pam Rajput also mentioned that in her presentation, that a legally binding instrument will not by itself resolve all the challenges older persons face. Its effectiveness will depend on political will, adequate resources, strong institutions, and sustained societal transformation. Let us hope that this possible legally binding UN treaty affirms the agency of older persons and safeguards their autonomy across all areas of life and all through their life cycle. We, the elderly, are not asking for mercy. We are asking for our long overdue rights. We need to be recognized not as burdens, but as rights holders and as vital contributors to families, communities, economies, and public life. We do not need shelter homes, but the right to live a fulfilling life. Ageism and gender inequality has to end with us. Thank you.